could you talk a little bit about
Yeah.
the word trust as it's used in the context of DLTs and how that's going to play into something like patients trusting products that are coming out, whether it's in the context of Clinical Trials Explorer or whether it's in the context of many of the other things you're working through?
Yeah. But I mean, you raised a very good, kind of, I guess, a little bit of history around decentralized computing for, because that was 20 years ago. And of course, a lot of us were experimenting and, oh, wow, look at this. I got, my favorite song for free. But it seemed kind of shady, right? It seemed like, wow, this is, and like you say, a lot of viruses and things. So, but that really was this idea of kind of peer-to-peer computing. That was like, I'm sending it to you from my computer to the world, things like this. So I think with blockchain and DLT where it is now, really it's this idea that there is a degree of computational trust. There is, but I mean, there's a, I think it's a misnomer. People think that if you're using blockchain, by definition, you're anonymous, and that really isn't true. Right? I mean, it could be this zero knowledge scenario happening, but in many cases, the decentralized computing, is not a predicator of you not having know your customer type of provisions, right? And many times, in fact, all the work that we do, as example, with our blockchain technology, we always have the cryptographic signature that proves computationally who we are, and that there's a whole trail of information, such as when a transaction happened, how much network fee there was, etc. All these things are there because ultimately, what nobody is saying is let's use blockchain to essentially create, like an obfuscation of facts. You can certainly be privacy preserving, and you need to be when it comes to, for instance, having information that is around patient healthcare, but that's different than having kind of essentially illegal transactions or things like this. So back to your point about kind of healthcare and things like this, or patient orientation and patient data and things like this, and where blockchain could fit in. Really the net of it, I think, is what is it that we think currently doesn't work, right? What doesn't work is to have one entity, a very large one, albeit, and typically tends to be that, essentially be the kind of the governor of all your information, and you're beholden to them, and then when things go wrong, or when you want to change course from what they want to prescribe, it's really problematic. So Facebook is a very good example of this, right? It's this idea that all your data is, essentially really owned by them, and if they change their policies and terms, well, that's kind of what you've signed up for. You are very much a product, right? So that's that. In the context of healthcare, I think what it means though is that many times, we as humans, we move, right? And our diseases, again, COVID is a very good example. They don't respect boundaries, right? They don't respect time zones and geopolitical boundaries. We move around. So our medical record really needs to be portable, and it's very much our data. So for it to basically sit within, the bastion of one entity is really not good. It doesn't make sense. It's not logical. It's our data. And then you look beyond that, if you want to make that data usable, like if I want to get on my phone, because I'm traveling, or because I want to go and watch, the Brooklyn Nets play, in their stadium, and I need proof of my COVID vaccination, and or proof of the, having taken the PCR test. All that stuff really belongs to me, and kind of, how do I get it? How do I make it easy to get to? How do I make sure it's trustworthy? All these things are kind of questions, and I think the net of it really is there's a number of things happening at the same time. One has been around this idea of data interoperability, and we have talked about this in healthcare, and the big kind of standard there is what's called FHIR, the Fast Healthcare Interoperability Resources, right? Essentially, it's just a variation of the underlying RESTful API protocols that the internet itself uses, right? So it's like a little variation to how the internet communicates. So you have that. That's good. That's definitely a good step forward. But then the next question is, and you and I know this, having been in healthcare a lot, is the data is all over the place, and it's sitting in all kinds of exotic, old, archaic, new systems all over the place. And now there's even more relevant data, like for instance, all your wearable data on your Apple Watch or Fitbit or whatever, or other kinds of wearables and your genomic data. All of these things really belong to you and complete the picture. So the question is, all right, now you can get it through some kind of interoperability or like readable standards. But then how do you make sure it's trustworthy? How do you really know that that was actually your latest? Like for instance, if you're retrieving your clinical data from whatever your portal of choices, was it the latest? Did you retrieve the correct observations that then maybe your next doctor would need to look at because you're traveling and that could be a relevant situation? And then, can you make sure that all this data is essentially kind of, basically really associated to you, its sources are trustworthy and they're not manipulated along the way, all these things. So when you look at it in that kind of a context, and your options are one, I'm going to trust one giant entity. Let's call it, Amazon or whoever. Like you guys are like a 500 billion, dollar business. So we're going to trust you because you're not going to go away. That's one option. That's been the option, but that's not really a good option. It's great for them. It's great for the Epics and the Cerners. They make a lot of money. It's brilliant. I mean, what a business model. Like, make it, make it non-interoperable and essentially own all the data. It's great for them, but not very good for everybody else. So the other alternative is, okay, we're going to have all these like little pockets of data. And then the issue is, well, how do we make sure that this data is actually coming at the right time, is secure, it hasn't been altered, and that's where blockchain kind of comes in, right? That's where decentralized computing comes in. Again, I exaggerated a little bit, but to be honest, not that much, right? So I think that where we're at, and it's not just for health data, but in general, for a lot of consumer-oriented data is people are understanding they own the data. People understand that there's value in the data. People understand that they could potentially even, get paid or have some kind of a remuneration, right, from the data, and the data is valuable. And then there's this idea that, look, we all have smartphones and we want to get to this data easily. How do we make it work? How do you make it all these things work? Where the user, the owner of the data has a say, at least can monitor it. And then you kind of give a chance or provide an opportunity for the user to be able to see the flow of the information, in whatever app they want. So when you look at it, and I added a lot of points together, but when you look at it in this kind of a context, you need some kind of an infrastructure for trust, for trust of data moving, right? That's the net of it. That's in a long-winded way. That's the net of why blockchain, where it could be used, but it's very much infrastructure. What it doesn't do, Darshan, and you know this very well, it doesn't, like, just because you have blockchain and you could say, well, the data flow is secure or is privacy preserving. That doesn't mean the data is useful. That doesn't mean that the patient is going to be able to get the information they need. That's a whole different thing, right? That's not infrastructure. That's building useful applications and building things that actually make people's lives easier and simpler, right? So I don't want to conflate the ideas of just because you're doing blockchain, it means you're building good applications.